A very good evening, everyone. Myself, Shauradip Odhikari. It is with great pleasure and honor that I welcome you to today's enlightening webinar organized by Modak Trainer Academy. The title of today's webinar is Indian Classical Music, an important tool for the effective correction of psychosomatic disorders. This is a very important subject in nowadays, which is becoming more and more relevant day by day. Now, I would like to share few words with all of you about our today's eminent speaker. We are privileged to have with us Dr. Sinchan Das, a distinguished scholar whose multifaceted contributions have significantly impacted both the fields of science and music. He did his bachelor's degree in homeopathic medicine and surgery (BHMS) from Pratap Chandra Memorial Homeopathic Hospital and College. Furthering his education, he obtained a postgraduate diploma from London and a postgraduate diploma in music therapy from the USA. His journey is a testament to dedication and passion. As an Indian classical vocalist, Dr. Das hails from the Rampur Senia Gharana, a lineage rooted in the traditions established by the legendary Mia Tansen. His unique style of singing, known as Tantrikari, has captivated audiences, earning him acclaim for his dedication towards devotional music and his mastery of rare ragas. In the realm of health science, Dr. Das has made significant contributions to the study of homeopathy. He has gained recognition for his scientific approach and successful demonstrations of homeopathic cases. His research includes exploring the impact of various ragas on psychological issues such as depression, stress, and insomnia. Throughout his career, Dr. Das has received numerous accolades, including the Wilmar Schwab Bronze Medal, Dr. A. Sen Memorial Award, and Dr. Gyan Chandra Ghosh Memorial Award, etc. Beyond his professional achievements, Dr. Das has shown deep compassion for both humans and animals. He has actively engaged in social work, dedicating his time to serving the less fortunate. Currently, Dr. Sinchan Das is the founder and director of the Humanity Institute of Advanced Medical and Cultural Research. Besides that, he is the director of Benevolentia Foundation and assistant professor at Brainware University, Kolkata. He serves as an academic advisor, faculty member, and executive member in various esteemed institutions and organizations related to health and music. Today, we have the unique opportunity to gain insights from Dr. Das's extensive knowledge and experience. So, without further delay, please join me in extending a warm welcome to our today's distinguished guest speaker, Dr. Sinchan Das. We look forward to an enlightening and inspiring session. I humbly request, sir, please start your valuable lecture. Over to you, sir. Thank you.
Thank you so much for this beautiful introduction. Uh, I'm very much privileged that Modak Training Academy invites me in this session. Uh, I hope that I'm audible to everybody.
Yes, sir.
Okay. As you have already know that today's topic is the music therapy and the effective treatment strategies in the psychosomatic disorder. Before going to the deeper discussion in this topic, I want to introduce the uh, term music and some preliminary introductory talk about the disease and health. As we all know that whenever the health as a definition it is concerned, health is the balanced state of physical, mental, and social well-being, and not merely the absence of any disease or infirmity. This definition is coined by World Health Organization, and in this definition, we all know that we can see that there is three parameters. One is our mind, one is our body, and another is our spiritual aspect and the social health. Whenever we are concerning the dimensions of health, there are lots of dimensions. There are physical dimension, there are social dimension, there are spiritual dimension, there are mental dimension, there are cultural dimension, and so on. So for the uh, state of equilibrium, if we want to make ourselves healthy, then we have to maintain the balanced condition between these all parameters. It is according to the definition of health of WHO. Now let us come to the definition of health as per the homeopathic principle. In that Organon of Medicine 6th edition, Dr. C.F.S. Hanneman mentioned that whenever the spiritual autocratic vital force it is flowing in an uninterrupted manner between each and every segments of our body and mind, then it can create the sense of well-being. That means our all the senses are in ease. And if this ease is disturbed, then that is known as disease. So first of all, whenever the health is concerned, one one major terminology is our vital force. And the vital force is that important force or energy which conveys its important role into several aspects of human body and mind. And not only human body and mind, rather it will create the interconnection between the universe and the physical entity. As we all are the energy, we all are the dynamic being. So being the dynamic entity, we all must have some dynamic properties and we must have some dynamic characteristics within us. And that dynamic characteristics is coined by Dr. Hanneman as the vital force. And that vital force is crucial in the maintaining of the state of ease. And whenever this vital force is damaged, deranged, or disturbed, it will create the sense of disease. Now, uh, we are now accustomed with the definition of health as per WHO as well as the definition of health as per homeopathy principle. Now, whenever the psychological context is concerned, whenever our mind is the matter of discussion, then the mind is defined, classified into three segments. We all know that the conscious, subconscious, and unconscious mind. Among these three, the major portion is our unconscious mind. A smaller portion, that is 4% of the entire section, is the conscious mind, and 1% is our subconscious mind. So 95% is about our unconscious mind. So it is that unconscious mind which is governing us, which is controlling us, which will make a connection between the individual entities, which are very crucial in maintaining this ease between the persons, between the creatures of this nature. As a result of that, each and every creature of the nature are going to make a uh, contact, and will going to make a relation in between them, and biologically which is known as ecology and ecosystem. But whenever it is concerning about the mind, we can say it is the ecopsychology. And this ecopsychology or geopsychology is that segment which is maintaining a core concept about the interconnection between the creatures of this nature and the human being. Now, whenever this dynamic entity is concerned, why should we are stating that, we are saying that each and every person is dynamic? Whenever we are segregating the body from the core materialistic entity to the dynamic one, the each and every body is basically composed of cells. And these cells are composed of some cell organelles, and those cell organelles and the fundamental components of cells are divided into the organic and inorganic compounds. And in the longer run, the inorganic and organic compounds are made with our molecules, and after that it will uh, divided into the atoms and then subatomic particle, and that subatomic particles like our proton, neutron, electrons and so on, and they are further subdivided or further segregated into the much simpler form, and finally we are getting our quark. And whenever this quark is there, that means it is the bundle of energy. So fundamentally, each and every individual in this nature is nothing but the bundle of energy. So if the fundamental component is bundle of energy, if the fundamental thing by which we are made, that is bundle of energy, then the condition, the balanced condition or the equilibrium must be created by, must be maintained by, and must be disturbed by only and only the dynamic entities or energy. So it is a very basic concept, and whenever this basic concept is concerned, the unconscious mind is that reservoir where each and every energy is stored, where each and every energy is going to be expressed in much more simpler form, much more coarse form, and it will in turn create something new, something definable, something perceptible. So these kinds of energies, whenever coming to the senses, whenever it is perceptible by the senses, that is our, one of those is our sound. And whenever the sound is concerned, the sound has some deeper impact on our mind as well as in our body, because our mind is basically governing the body. That's why we are considering our body as the psychosomatic entity. So if the problem, if the disease, if the disturbance is arising from the mind, and that disturbance is disturbing our somatic entity, that is our physical entity, then that particular condition is known as our psychosomatic disorder. So whenever this psychosomatic disorder is concerned, then the first and foremost component of the disturbance, or first and foremost point of discussion should be our psychological status, should be our mind. And by the way we are training our mind, by the way we are instructing our mind, the mind will act accordingly, and the mind will act as according to the psychoneuroendocrinal axis. There are a number of psychoneuroendocrinal axes which are responsible for the release of the number of hormones, number of trophic hormones, as well as number, they are important for the formation of the functional hormones. And we know that the hormones and enzymes, they are the basic fundamental things which are controlling a series of metabolic and bodily activities. So all the disease, if we are considering the total wholesome of the disease, a major portion of the disease is considered as the psychosomatic disorder. Not only disorder, rather a term is there that is known as indisposition. The indisposition is very crucial term, which in turn create the acute manifestations in some days, or in the long run it will create the chronic manifestations. And whenever this acute and chronic, these two terminologies are used in repetitive manner, but I should clear that in the homeopathy and in the dynamic medicine or in the integrative medicine, the concept of acute disease and chronic disease is something different from the conventional uh, methods. In the conventional methods or conventional science, the acute means which is very new, which must have some course of time. That is acute. And if the acute disease is maintaining its course for a longer time, it will turn as the chronic disease. But in the dynamic medicine, in the holistic medicine, in the music therapy, and in the integrated medicine, the concept of acute disease is same. There might be some meteoric and teleoric cause, or it might be due to some acute miasm, and which must have some specific time of action, and it will treat it, it will go away with treatment or without treatment. It may harm the patient or it may not harm the patient. So it must have some course of activity. That is for the acute disease. And when the chronic disease is concerned, the chronic disease is very slow and insidious in onset. First point. The slow and insidious is in its origin. Secondly, whenever the chronic disease comes, it will never ever perceptible to the patient, because there is a manifestation known as physiological symptom. That physiological symptom makes the patient unaware about the state of disturbance, because that state of disturbance is not that much impactful in the daily activity of the patient or daily activity of the individual. That disturbance, or that disharmony, rather better to say, that disharmony is very much crucial in identifying the long course of the chronic disease, because that physiological symptom in turn comes as the indisposition. And if the maintaining cause is still there, if the fundamental cause is still there, and we left that untreated, then that will turn into the chronic manifestation. And that chronic manifestation is entirely dependent on our fundamental cause. That means the root or seed of the disease. On that, our maintaining cause, that means our occupation, our lifestyle, our relationships, our etc., etc. Many things are the maintaining cause. Our food habit and our way of thinking. By the way we are thinking, by the way we are perceiving, by the way we are analyzing, by the way we are talking, we are behaving, we are standing, we are walking, each and everything is determinative factor, or each and everything is important for the identification of the maintaining cause, the deranging cause of the deranging extra cause as the fundamental extra cause on the fundamental cause, and something exciting cause, that means our morbid cause or the microbiological causes. So we now accustomed with what is disease and what are the basic cause of disease. That is our fundamental cause, our maintaining cause, and our exciting cause. And also there are some extra form of causes like the causa occasionalis. That means the occasional cause of disease. The occasional cause of disease, that means that particular cause is not applicable for each and every individual, but that is applicable for some group of individual or some individual which is very unique for that particular person. So we are considering that particular cause as the causa occasionalis. Second one, another is your prima causa prima causa morbi. That is primary morbid cause of disease. That is which is deranging our health in the very insidious manner, which is not perceptible, which is not identifiable to some extent. That is our prima causa morbi. So these are the causes or the etiological factors for the disease. Now, whenever this particular situation is concerned, a person who is in the course of their development, that particular person is firstly facing the fundamental cause or the fundamental characteristics of that individual. With the characteristics, the patient is born. With the characteristic, the patient came to the earth. That is the fundamental cause. In homeopathy, we are termed as the miasmatic background. That means the characteristic of the patient, the mental characteristic, the physical characteristic, the social characteristic, as well as the uncommon peculiar characteristics of the particular individual. That is known as the miasmatic background of the patient or the miasmatic characteristic of that individual. Similarly, in the conventional science, we can say that it is the genetic character of the patient or genetic character of the individual. With the character, the patient is born. With the character, the patient is starting the development. That is the genetic cause. That is the genetic characteristics within which frame the patient must lie, within which frame the patient must develop, within which frame the patient must grow up. That is their genetic characteristics. And that genetic characteristics comes from the father and mother. Similarly, it is creating a lineage. It is creating a family lineage by which the person is continuously in the state of development or in the state of degradation. Both can be applied, both can be applicable for this condition. Whenever the patient in the long term is developing, as the human race is developing day by day, not only human race is developing, rather the pathological conditions are also developing. But what is the reason behind that? The reason, as the person is born with some fundamental characteristics, that particular person is equipped with some specific characteristics. That particular person is behaving in some unique manner. That particular person is analyzing in some unique manner. That particular person is perceives something in some unique manner. But whenever we are intending to make a generalized pro forma, a generalized benchmark for each and every individual, then that particular non-individualistic or generalized approach will create a serious disharmony in the qualifying characteristics of that individual. So, in the qualitative manner, we are damaging the individual for their social existence, as we are creating a systematic group, and within that group we are intending to fit that individual. We are forcefully fitting that individual, which is not actually possible. And whenever this kinds of practice is going on, that particular person is starting to adopt a serious uh, problem, a serious problematic phenomenology that is known as manipulation. That particular person is starting to compromise himself or herself. That particular person is starting to suppress himself or herself. And that suppressive, compromised characteristic or compromised practice will create a serious impact on their mind. And in the long run, the person is equipped with some manipulative practices. The person is equipped with some faulty practices, which in turn create some serious problem, some serious alteration in their conscious and subconscious mind. And these kinds of problem will create a sense of conflict. And whenever the person is facing the conflict between their actuality and the practice, that will create a sense of confusion. And that sense of confusion in the long run will compromise their productivity. The performance will going to be compromised. The performance, whenever the person's performance is going to be compromised, the valuedness of the person is going to be decreased. The expectation from the person is the performance of the person is not matching with the expectation, and that will create some expectation performance mismatch. And whenever this expectation performance mismatch is uh, wider and wider and wider, it will create some compromised, perceivable practices for that particular individual and the group of individuals around the person. And that will create again the psychological burden on that individual and the family of the individual. It is it is just from the work culture, and it is also impactful on their personal life, on their family life. And whenever his family life or her family life, that particular individual is not uh, giving his or her 100%, that will create some negative impact on the family members also. And in the long run, this expectation performance mismatch, the sense of conflict, the sense of confusion is creating a sense, a notion of some superimposed individuality. And that superimposed individuality is absolutely different from the person's actuality. As a result, the person is going to lose their productivity and their identity to the to himself or herself. And as a result of that, the person will uh, not going to adapt something. The person is be less creative, the person is dominative, the person is resistant, the person is arrogant, the person is rationalizing, the person is denying, etc., etc. So the basic problem is the perception. The basic problem is the teaching. Whatever we are teaching to the person, whatever we are instructing somebody, if that particular instruction is not aligned with the truthfulness and the actuality of our unconscious trait, it will create the sense of conflict. As the unconscious trait is the divinity, as the unconscious state is that divine characteristics that needs to be harmonized in all the sense, from all the senses, in all the manner. But when any sort of disharmony is there, if any sort of dynamic disharmony is there, that dynamic disharmony of any individual will create a gross disharmony in this unconscious field, or this unconscious organized field, because each and every individual are interconnected, just like a 3G, 4G or 5G network. Each and every individual are interconnected with each other, irrespective of they are human, they are dog, they are cat, they are birds, they are plants, whatever may be. All the senses, all the living entities are organized and interconnected with each other in the unconscious sphere, in the dynamic sphere. So if any sort of disharmony is occurring in some A or X person, that X disharmony, that disharmony in the X person will create a gross disharmony in the total unconscious sphere. So a single disharmony can create an impact. Maybe it is perceivable, maybe it is not perceivable, but that disharmony is creating an impact on this universe. As a result of that, a single disharmony will create a gross state of disharmonious condition. As a result of that, the modern example of the disharmony is the violence. As we are living in this scientific era, in the modern era, in the advanced era, but still we are in the state of violence, we are state of intolerance, we are state of disharmony. And whenever these characteristics are still within us, it is nothing but the characteristic of the animalistic behavior of of the particular person. And this animalistic behavior, this disharmonious behavior, this violent behavior, this is the result of the long-term violent practices, long-term manipulative practices of this by the mankind. Now, whenever each and everything is dynamic, whenever each and every particle is always oscillating, and that will create a particular sound that will whenever each and everything is vibrating rather, so that will create a sound that may be perceivable, that may not be perceivable, that may be ultrasonic sound, that may be sonic sound, that may be supersonic sound, but that sound is there. As we all know that there is a sound of universe, that is Om. The Om is nothing but the sound of emptiness. Om is nothing but the humming. Om is nothing but the nad, which is called nad, and that is known as nad brahma. In the music therapy, whenever this music term is concerned, this music term was first introduced in the year of 1630. Prior to the 1630, the term was music, and that music or music comes from the Greek word, and that means it is something which is created by 9 deities of the mythology, of the ancient mythology. Because this sound is considered as the most pure form, this music is considered as the most pure to worship the god, because we are thinking that this music is just for the worshipping the uh, master of this universe. And this music, how the music is created, we are talking about the music whatever we are performing, but each and every living entities has their own music, their own sound. If we are living, if we are oscillating, if uh, we are in this earth, in this universe, so each and everything is vibration. Each and every phenomenology must be governed by the vibration, and music is everywhere. But what could be called music in this therapy, that is the uh, creation by us. What is the music? Music is the arrangement of sound to create some combination of form, harmony, melody, rhythm, or otherwise expressive content. So basically, music is the synchronized syllables. Music is the synchronized syllables of this art. What could be called as music, syllables of music? Sa re ga ma pa dha ni sa in the Indian classical music, and the scales in the Western classical music or Western music. So in the Indian form of music, whenever we are concerning about the sa, that is sharaj, re, that is rishav, ga, that is gandhar, ma, that is madhyam, pa, that is pancham, dha, that is dhaivat, ni, that is nishad. We have 7 major notes, and along with that 5 minor notes or vakra notes, 7 Shuddha notes or major notes, and 5 Vakra or minor notes. And by with the combination, by the permutation and combination of these 12 notes, we are creating the music. We are creating our ragas, our Indian classical music. So the tunes or the suits, there is again 2 terminology. One is swar, another is sur. The swar means sa re ga ma pa dha ni sa, these are the swaras. And whenever sur is concerned, that is tune, that is melody. When this swar is the swar is filled with the emotion, the swar is connected with the emotion, it will create sur or tune or melody. And each and every single swar is expressive of some specific emotion. We are thinking that these 7 notes or the 12 notes, they are the living entities. They can talk, they can walk, they can eat, they can express their emotions, they can express their inner feelings. And as a result of that, whenever we are mixing something, Whenever we are creating some ragas, that raga is representing the rasa. And that rasa, that means the uh, inner expression, the expression of our inner emotions, expression of the emotional states, expression of the moods, because these rasas are connected with the mood. And what is the music therapy? Music therapy is just creating that mood, the creating that particular flow, that seat within which we can reside, within which we can jump, we can swim, we can live. Whenever a person is depressed in their mood, whenever a person is unable to cry, whenever the person is suppressive, whenever the person is emotionally uh, ditching themselves, then we, through music, we can make the person to cry. Whenever the person is crying, that means the inner pain is now relieving. As an example, we can say that, say about the raga Darwari Kanara. In Darwari Kanara, we are the rag is used for the treatment of serious depression. And whenever this depression comes from the sim, uh, from the suppressed grief, suppressed anger, uh, uh, isolating characteristics, and the compromised dream, some sort of emotional shock, some sort of emotional trauma. In case of post-traumatic stress disorder, we are opting for this raga. And whenever this raga was played for a considerable time, in some considerable volume, in some considerable instrument, rather, it will make the person to cry. Suddenly the person starts crying, and we must not stop the person in that particular situation. Let the person cry. And whenever this crying is continuing for some time, it might be for some episodes, it must be for some paroxysm. But after that, the person is absolutely a newer one. It is about the receptive music therapy. Among the types of music therapy, it is termed as receptive music therapy. Whenever a particular song, a particular tune, a particular raga is played for the individual, and the particular person is receive something, the person is perceiving some music, and accordingly the person is reacting, and that reaction is spontaneous, that reaction is not manipulative. And whenever the music is going on, we have to record the facial expression of the person, we have to record the gait of the person, if any facial expression is altering or not, if any sort of emotional turmoil is creating on their mind or not, if any sorts of alterations we can notice in their state of health, state of not health, their present state, then that is useful for the prescription or the management of the second phase for the patient. So the first of all, we have to give some exposure, and on the basis of that exposure, we have to read each and every alteration of their mind as well as their body, uh, through their expressions. That might be through their facial expression, their eye movement, their iridological alterations, or etc. Even we can take help of graphology in this context, we can take help from the color therapy in this context. I'm coming in the next session, next part of this music therapy, that is known as compositional music therapy. We are now talking, we just talked about the receptive music therapy. Now come to the compositional music therapy. In case of compositional music therapy, the patient or the individual or the client, as per the psychology, we are to use the terminology as client or the individual, that particular, we are helping the individual to create something, and it is applicable for the music therapy as well, it is applicable for the art therapy. In the art therapy, we give some random color to the patient, to the individual, to know the state of health, state of mind, whatever the color the person is opting for, whatever the creature, whatever the object the person is creating, that is basically significant about their state of mind, their present state of mind. Similarly, whenever the music is uh, composed by the individual, which uh, whose emotional state or whose state of mind is going to be read, going to be understandable, and that particular state is uh, judged by, that particular state is no understandable by the composition. If the person is creating something which is very much creating with some minor notes, when the lots of minor notes are used in the composition, then that clearly means that that is significant of their emotional turmoil, that is significant of their emotional trauma. And if the note is oscillating, if the note is in the mid, or if the note is in the andolan state, that just because just like the darbari sa re ga ma re sa, this ga is creating the core emotional mind, that guy is creating some it will digging the emotional trauma, and that condition will create some that condition is expressed as the cry. Similarly, whenever we are uh, taking some pentatonic scale, just like the rag bhup or bhupali, sa re ga pa da sa da pa ga re sa, these five notes are there, and whenever these five notes are there, it will create a sense of stability. And not only the sense of stability, this bhupali is just like a uh, calming state. It will create a calming state, as if the inner child is crying for help. And whenever bhupali is going on, your inner child is now balanced with your external social expressive character. So the bhupali is uh, helping us to maintain the balance between the actual us and the social us. And it will create, not only it will create some balance, it will uh, create a mood, it will create a calm and quiet mood of that particular individual. Similarly, if we can talk about the rag malkosh. Rag malkosh is a midnight rag which is composed, which is again a pentatonic, but this bhupali was of all the major notes. And whenever this malkos is concerned, this malkos is having gadhani as the minor notes. So it is of, it is for that emotional state which is uh, something connected with the emotional trauma or emotional turmoil, or or whenever this particular emotional turmoil is coming from their love, their closest one, their uh, their very soft one. From that respect, we are concerning about this rag malkosh as the emotional stability, as the raga for emotional stability, when the cause of emotional stability is connected with the relationships. So these are some examples. And whenever, how this psychosomatic state is, how the, if we are treating with some music, is it possible to cure some incurable disease without any pharmacological help? The answer is no. If this disease is already in the psychosomatic state, we have to treat the somatic condition with the correction of lifestyle, with the correction of foods, with the correction, with the application of the pharmacological agents, which is needed for balancing or maintaining the state of disease in that particular condition. As well as we have to correct the state of mind, because it is ruling us. If we are training the mind to create the sense of stability, then it will harmonize the body. As a result of that, the endocrinal substances, the chemical substances, the enzymes which are uh, secreting in our body, which are synthesized in our body, that will become normalized in the longer run. So if we take a case of diabetes mellitus, as we know that India is now the diabetic capital, and if we take this case of diabetes mellitus, a major portion of the diabetes, major etiological factor of the diabetes is stress. And that particular stress is coming from the suppressed emotions. Whenever a person is unable to express their inner self to somebody, to the society, whenever the internal emotions, the inner self is not expressible, whenever the inner self is not expressed towards the society, towards the exterior, it will create a serious disharmonious turmoil within us. And that disharmonious turmoil will create some adverse effect on our pineal gland. And when our pineal gland is taking that particular exposure as the danger, so the secretion of the melatonin is reduced. As a result of that, in the longer run, the dopaminergic activities will become compromised. And when the dopaminergic activities will be compromised, it will create a serious condition as the stress. Music can help to secrete the dopamine within the brain. The condition, it is very it will be wrong if the condition is considered just as the neurological state. If we are taking the condition, yes, it is just because of the deficiency of dopamine, so we must balance the dopamine as the through the pharmacological agent, and the mood will be stabilized. Perfect. But whenever you are supplying the dopamine from the exterior, it can be manageable as the acute state. But whenever your brain is not trained to secrete dopamine, whenever your brain is not informed how much dopamine the brain is needed, how much dopamine the brain needs to be secreted, and that particular condition will create the drug dependency on the dependency of, or the dependency on the pharmacological agent. In the longer run, as the maintaining cause is there, it will create some resistance towards or against the pharmacological agent. And that particular resistance or that particular condition, or the secondary counter activity of the drug, or secondary counter activity of that individual's vitality, will create some serious impact on their holistic health. And not only that, that particular situation, that particular state will devastating must have some devastating effect on their holistic surroundings and the holistic existence of that individual. So in music therapy, in any form of therapy, in any form of treatment or management, we must consider that particular condition as the holistic, that is the result of our mind, our body, and our society, our surroundings. But if we are taking that any of these as the soul or the independent entity, then that will create some adverse effect. As a result of that, now we are residing in the diseased era. Just because of this manipulation, just because of this faulty understanding, just because of the impaired fundamental cause, just because, and whenever these factors are going on, it will create some epigenetic alteration, and that the altered state, that the compromised state is in the farther run is transferred to the next generation. So the developmental anomalies are continuing, and the pathological state is worsening day by day. And this pathological state, whenever it is worsened, when this worse pathological state is signifying, this pathological state is having some serious impact on the economy as well as on the gross productivity of the individual. So if we take some chronic disease, we must consider the actual physical state as a result of the actual psychological state, and afterwards we have to correct the psychological state with the uh, cognitive and behavioral therapy, as well as with the color therapy and music therapy. After that, we will we can automatically subside the physical manifestations in the longer run. And the next and the final next point is our music therapy as the cognitive and behavioral therapy. In the Western music, whenever the music therapy is concerned, they used to consider the music as the synchronized activity. As in the violin, as in the piano, they are training the individuals, particularly they are training the intellectually compromised individual, the persons with autism spectrum disorder, the persons with Down syndrome, the persons with Turner syndrome. They are trained in this sorts of musical activities just to train their mind in the synchronized activities, just to train their mind to express, to behave. So in the Western, the music therapy is just for the behavioral correction, not for the emotional state, not for the emotional correction. But in the Indian classical context, the music therapy is for the emotional correction at the very beginning. After that, it will for the behavioral correction. A common practice or common statement in the music is there: if a person is practicing music for a considerable time, that person has to be disciplined, the person has to be proper, because the music, that means the synchronized activity, will create the sense of synchronization within the mind of the individual. So whatever the person, whenever whoever the person is practicing music, particularly I am talking about the traditional music, that traditional music will create that disciplinary training to the brain, training to the mind, so that the person can decide a zone of discipline, decide a genre, decide a zone of creativity, decide a zone of productivity. So in the conclusion, we can say that music therapy is very useful tool in the psychosomatic state, and whenever it is applied in the judicious and rationalized manner, whenever it is applied additionally with the pharmacological support, whenever it is properly diagnosed, whenever it is properly uh, properly planned and implemented, it will it must be impactful for each and every suffering individual. Thank you.